Cardiac arrest is a life-threatening emergency that occurs when the heart suddenly stops beating. It occurs when the electrical node that controls the heart rhythm malfunction or produce an abnormal heart rhythm that known as arrhythmias. While different arrhythmias exist, including atrial or ventricular tachycardia, bradycardia, fibrillation, asystole, not all arrhythmia result in cardiac arrest. Sudden cardiac arrest occurs when an arrhythmias develop that prevent the heart from beating.
This cardiac arrest happens without warning. If someone in cardiac arrest, they collapse suddenly, will be unconscious, unresponsive, and won't be breathing or breathing normally. Sudden cardiac arrest usually related to people who have no known or undiagnosed with heart condition. Common cause of sudden cardiac arrest is ventricular fibrillation, and the main cause that are related to the heart condition such as heart attack, cardiomyopathy, heart valve disease, congenital heart disease. Therefore, without immediate treatment or medical attention, the person will be died. So, if you see someone with a cardiac arrest, phone 999 immediately and start CPR.
Now, focus on the symptoms of cardiac arrest.
What are the symptoms of cardiac arrest? Some people may have symptoms, but some may not. These symptoms may happen right before the cardiac arrest happens. First is chest pain. The pain usually felt on the left side of the chest, described as crushing pain, and it radiates to the left shoulder, jaw, as well as the neck. Second is shortness of breath, means that you will have difficulty in breathing. Third is palpitations. You may feel like your heart is beating faster than usual. Followed by fatigue, dizziness, and then syncope. In the worst case scenario, some may not have any symptoms and leads to sudden death.
What is CPR and the importance of CPR? So when a patient suffers cardiac arrest, the blood will not circulate, the heart will stop to function, and patient will stop breathing, and he will eventually lose his consciousness. This is because without oxygen being passed from the lungs to the bloodstream and to be pumped around the body by the heart, the patient will suffer irreparable brain and other vital organ damage and will die within minutes. To avoid such a situation, one must be given immediate first aid attention, which is the cardiopulmonary resuscitation, or also called as CPR, which is the first aid technique that can save lives in such situations if performed correctly. So what is CPR? It is essentially combines chest compressions and rescue breathing to supply oxygen to body during cardiac arrest. So what is the importance of CPR? CPR supports heart and lung function when it appears to be inadequate. CPR also provides oxygen to the brain and other vital organs until help arrives. So early CPR will decrease the chance of brain damage. CPR also greatly improves an individual's chance of surviving during a cardiac arrest.
These are the steps for CPR.
First, position yourself in a way that allows you to apply vertical pressure during compression. Visualize the center of the casualty's chest and put the palm of one hand on that point. Put the palm of the other hand on top of the first and interlock the fingers. You can also hold it firmly around the wrist of the first hand. Either method is acceptable. Make sure both your arms and forearms are in straight position. Do 30 chest compression at the rate of not less than 100 compressions per minute, and each of the compression should depress the chest 1.5 to 2 inches. After each of the compression, release the pressure completely, allowing the chest to recoil. After the 30 compressions, open the airway by lifting the chin and tilting the casualty's head backwards. Pinch the nose to close the nose and open the mouth with the help of the chin. Give 2 rescue breaths, and each of the breaths should not take more than 5 seconds. Continue the CPR until the patient wakes up or once the medical aid arrives.